Hello everyone. Here we are going to discuss a topic that is Cushing syndrome. In your exam, you usually get a short question on that, so you have to understand the etiopathogenesis and clinical features of Cushing syndrome. But before that, you have to understand everything about the adrenal gland, that is its anatomy, physiology, and functional status, everything. Then only you can understand the Cushing syndrome well. So let's start the topic. Cushing syndrome. So here you can see we are starting the topic that is Cushing syndrome. So before coming on the topic Cushing syndrome, I will let you know normal adrenal gland anatomy, adrenal gland physiology, the biosynthesis of various adrenal hormones, adrenal steroids. So then I will let you know glucocorticoids function. Then I will let you know the regulation of the cortical secretions, the cortical hormones. And then we will come on various patterns of hyperadrenalism. One of the important pattern is Cushing syndrome. So if it is this question is coming in your exam, you don't have to write all this, but it is for your understanding. If you don't understand this, you cannot understand the topic well, Cushing syndrome. So let's start from the basic. Let's start from the scratch. Okay. So let's start the adrenal gland anatomy. Human have a pair of adrenal gland. Can you see the pair of the adrenal gland, which is present at the superior pole of the kidney? So it's a very small gland. It hardly weighs 4 gram in weight. It's very small. There are two adrenal gland, pair of adrenal gland, and they are present at the superior poles of the two kidney. Now inside the gland, there are two portions, cortex and medulla. So outer portion is cortex. Let me show you. The outer portion of the gland is cortex. Can you see the outer portion of the gland? Each of the gland, the outer portion is cortex and the inner portion is medulla. The inner portion is medulla. So outer is cortex, the inner is medulla. The cortex is further divided into 3 zones. I will show you the zones. Zona glomerulosa, zona fasciculata, and zona reticularis. So you can see it here. It is the 3 zones. Zona glomerulosa, zona fasciculata, zona reticulosa. That is the cortex, not the medulla. So same thing is written in front of you, the cortex and the medulla. So outer portion is cortex, inner portion is medulla. The cortex is divided into 3 zones, zona glomerulosa, zona fasciculata, and zona reticularis. It is known as GFR. GFR. It is known as GFR. So I will draw it for you. So let me draw a pair of kidneys for you. You can see here I'm drawing the pair of kidneys. So at the superior pole of the kidney, we have a gland known as adrenal gland. I'm drawing large just to show you. It's very small gland. So it's very gland. I'm drawing it largely disproportionate to show you the parts. Now we divide the gland into 2 portions. Outer portion is cortex and inner portion is medulla. So this is medulla. You can see this portion is medulla and outer portion is cortex. So we will divide the cortex into 3 portions. So the outermost zone is zona glomerulosa. The middle zone is zona fasciculata and inner zone is zona reticulosa. So it is GFR, zona glomerulosa, zona fasciculata, and zona reticularis. So that is the 3 zones in the cortex, not in the medulla. In the medulla, we have only one type of cell, chromaffin cells. So chromaffin cells are present. In the medulla, only chromaffin cells are present. Now, what does all these things are synthesizing in the adrenal? So from the zona glomerulosa, mineral corticoids are synthesized. From the zona fasciculata, glucocorticoids are synthesized. And from the zona reticularis, sex corticoids are synthesized. So these are the corticoids which are synthesized from the cortex. Medulla synthesized catecholamine. Medulla, from the chromaffin cells of the medulla, catecholamines are synthesized like adrenaline, noradrenaline, dopamine. These are synthesized from the medulla. So this is the normal anatomy of adrenal gland. So you must understand adrenal gland, the normal anatomy. So same thing is written in front of you. So in the adrenal, we are having 2 portions, the adrenal cortex and the adrenal medulla. Adrenal cortex is divided into 3 portions. Zona glomerulosa synthesized mineral corticoid, fasciculata synthesized glucocorticoid, and reticularis synthesized sex steroids. And in the medulla, we don't have 3 zones. We have only chromaffin cell, which synthesize catecholamine like epinephrine, norepinephrine, and dopamine. So the same thing you can see it here. See the transverse section of the gland. You can appreciate this is cortex. Appreciate the cortex. And the inner portion, you can see. This is outer portion, the cortex. The inner portion is the medulla. You can appreciate. So this is the transverse section of the gland. Now see the layers. In the cortex, you can see zona glomerulosa, zona fasciculata, and zona reticularis. And below that, it's medulla. So I hope you all got it. Now biosynthesis, as I told you, the 3 type of steroids are there: glucocorticoid, mineral corticoid, and androgen. So mineral corticoid are synthesized by zona glomerulosa. Glucocorticoids are synthesized by zona